Senate Higher Education, Finance and Policy Committee to order. Today is Tuesday, March 22nd, a little bit after 1 o'clock. Members, we have four bills on the agenda today. I believe we got an old agenda. Senate File 4055 will not be heard today. It will be the other four. Our first bill up is Senate File 3424. Senator Koran, I will move your bill to be in front of the committee, and you can begin your testimony.
Thank you, Mr. Chair. This is the first stop. I also have an A1 on author's amendment, so if we could move that as well.
Very good. I will move the A1 author's amendment. All in favor say aye. Aye. Opposed, no. The amendment is adopted. To your bill is amended, Senator.
Thank you, Mr. Chair. And before we move on, just to explain the amendment, if we could have, council recommended that we make a change on the utilization of the funding. So if they could just cover that, and then I'll proceed.
Mr. Chair and members, yes, Senator Koran is correct. The A1 amendment is a technical amendment, adding in a use for the funds to be available until June 30th, 2027, to allow the $1.2 million to be spent over the 5-year period that's stated in the language.
Thank you very much.
Thank you.
Senator Koran.
Thank you, Council. Thank you, Mr. Chair. Appreciate the opportunity to present Senate File 3424. Members of the committee, we appreciate you hearing the bill. This bill deals with the funding of only addiction, or for the only addiction medicine fellowship program we have in Minnesota. Since being elected to the legislature, I've been very open about the disease of addiction and what it's done to my family. It's been massively impactful. Unfortunately, it prepares you really well for this role, serving as a legislator. But access to treatment facilities is limited. In fact, only about 10% of the people with substance abuse disorder receive treatment they need. Some of the lack of treatment service is structural, and some of it's related to historical stigma around substance use disorder. It was in 2008 that Congress passed the Mental Health Parity and Addiction Equity Act, and a federal report released in January of this year found insurers and health plans are failing to provide mental health and substance use treatment coverage at the same level as medical and surgical benefits. And it's a major barrier to care, especially in those already struggling to get help. Another problem is we don't have enough clinical providers trained in the specialty of addiction. Graduating physicians out of med school today only receive about 6 to 8 hours of training about the disease and its impact. And it impacts tens of millions of people and their family. Over the past several decades, there's been expanding awareness of the importance of substance abuse education for medical students, residents, practicing physicians, and everyone involved. We're lucky to have one of the first addiction medicine fellowships in the country, housed at HCMC and the University of Minnesota Psychiatry, with rotations at those facilities and the Minneapolis Veterans Hospital as well. Senate File 3424 would fund training of 15 physicians in addiction medicine over 5 years. With me, we also have a couple testifiers, Mr. Chair, Dr. Sheila Spector, and who's the Director of Fellowship, and Dr. Graham from HCMC. So if Mr. Chair would like to go and have our testifiers testify now.
Very good. Thank you, Senator Koran. First on our list is Dr. Spector. Would you please identify yourself for the record, and you can begin your testimony when you're ready.
Mr. Chair and members of the committee. Oh, thank you. All right, Mr. Chair and members of the committee. My name is Dr. Sheila Spector, and I am a practicing addiction psychiatrist at the University of Minnesota and the program director of the Minnesota Addiction Medicine Fellowship, which is shared between Hennepin County Medical Center and the University of Minnesota and the VA Medical Center. And as Senator Koran mentioned, we are the only fellowship in the state that trains physicians in this specialty that intersects many different fields, including public health, psychology, social work, psychiatry, and primary care medicine. Of the 21 million Americans that have an addiction, just under 2,000 physicians are specially trained to treat them. The lack of trained specialists is why there's only 1 in 10 people with a substance use disorder that receive treatment in the United States. And I'm sure we're all acutely aware of the skyrocketing overdose deaths from opioids, which are now largely fentanyl, and most dramatically in the African American population and the Native American population. And in Minnesota, there are 30-some counties that do not have physicians with federal approval to prescribe highly effective medication. This is buprenorphine for opioid use disorder. The pandemic also has triggered an increase in alcohol use and methamphetamine use that has been on the rise, and particularly in rural counties. The 12-month fellowship program began in 1982, and I was one of the early fellows in that program, and trains physicians to be experts in the prevention, clinical intervention and evaluation, treatment, and ongoing care of persons with addiction. Fellows are trained to treat patients throughout the lifespan, from prenatal to adolescence to geriatrics, using evidence-based therapies. And these are medication-assisted therapies, in- and outpatient therapies, and therapies for co-occurring psychiatric disorders. The program trains physicians particularly to be leaders and educators of other physicians. Nearly all of our graduates are practicing in Minnesota, some in academic settings, such as Hennepin County Medical Center, the university, or the VA, and others in rural, community, and underserved areas. Dr. Gran, who will testify next, is one such graduate of our program who has gone on to lead a project which addresses the statewide epidemic with opioids. The program recently obtained full accreditation by the Accreditation Council for Graduate Medical Education, which has also recently approved an increase in the number of positions because of the great need to expand the workforce. And I have a current fellow here with me, Dr. Ingrid Yelkin, who is a current fellow who has been in family medicine practice for about 15 years, who has elected to do this fellowship to better serve Minnesotans. Each year, the program struggles to cover stipends due to lack of sustainable funding. GME, graduate medical education, residency, and fellowship programs are funded through federal monies. Teaching institutions receive fundings for a fixed number of slots, but there aren't enough funds for the fellowship, unlike the funds that are available for residencies and other programs. Each year we request funding from the GME, but it's been either unavailable or inconsistent. We'd welcome ongoing funding, but this proposal would allow us to train 15 physicians over 5 years, and per year it would be $240,000, totaling $1.2 million. We look for other sources of funding, such as grants, and many years ago we were awarded a federal grant from the National Institute of Alcoholism, and that's how we were able to train Dr. Gran, who will next testify. We appreciate past support of the legislature, and we actively pursue all avenues of funding. This program is a statewide resource that expands the workforce of physicians trained in addiction and hence can reach populations most in need of addiction care. Thank you, Senator Koran, for authoring this legislation and Senator Tomasoni's willingness to hear it. Thank you.
Thank you, Dr. Specker. Our next testifier is Dr. Gran, online. Please identify yourself for the record and begin your testimony when ready.
Hi, Mr. Chair, members of the committee. My name is Dr. Brian Gran, and my clinical practice is at Hennepin County Medical Center, focusing on the care of people with substance use disorders, as well as the social, medical, and psychiatric conditions that often co-occur together. Thank you for allowing me to testify today on Senate File 3424, which, as Dr. Specker mentioned, and as Senator Koran mentioned, will provide 5 years of stable funding for the only addiction medicine fellowship in Minnesota. And honestly, the funding couldn't come at a more critical time. As a graduate of the fellowship and the training it provided, it's really been critical to my ability to lead Hennepin Healthcare's integrated opioid and addiction care ECHO. And ECHO programs consist of a hub, which is an interdisciplinary team of specialists, connecting to spokes that are typically providers in rural and underserved areas, or primary care providers who don't have the specialized training in order to treat a particular illness. And these groups connect via video conferencing like Zoom for didactic and case-based learning. And through ECHO, we've been able to educate community providers across Minnesota on how to better manage their complex patient populations in their own communities. And while developing their own additional knowledge and expertise. And these kind of weekly hour-long sessions include a combination of as I mentioned, the lectures and case-based learning to kind of build their own expertise in order to be able to take care of people locally, when many times, particularly with opioid use disorder, people don't want to travel hours away as they may for cancer or for other types of specialized treatment. So you have to provide care locally, which is one of the benefits for having fellowship-trained physicians, where we can kind of leverage these expertise more and more to wherever people may need. Yet, we still need more. So the training that I've received has really been able to be a valuable asset in order of these last couple of years. The ECHO has been going over the last 3.5 in particular. During that time, using the training that I received in the fellowship, we've been able to train another 1,000 healthcare team members, 1,000 team members, in best practices related to the use of buprenorphine for opioid disorder and associated topics like pain management, psychiatric disorders, and other conditions. We also hosted collaboratively with a variety of different groups across the state buprenorphine boot camps that trained another 125 providers, both to get waivered as well as to start transitioning that into actual practice. We've provided another 3 online waiver trainings that have trained another 125 healthcare providers, from obstetricians to family docs to emergency department providers and a number of other specialties in between. Those sessions provide hands-on training as much as possible during the pandemic, as well as provide mentoring and case discussions for healthcare providers in settings ranging from EMS, emergency medical services, to the emergency department, primary care, pediatrics, and obstetrics. And the curriculums that I've been able to help provide, working with experts across the state and across the region, using the fellowship training that I had, has really been the foundation for how to even leverage and get these other people trained to provide care in their communities. You may see we included a map produced by the Minnesota Management and Budget Team showing where providers have come from that have attended ECHO sessions. And you can see that Minnesota providers and care teams have attended from as far away as Ortonville, Thief River Falls, Grand Marais, and Faribault. So we're really catching, even though we're based here in Minneapolis, the point of this is we're able to leverage and train people across our entire state. And the fellowship also has led me to partner with Dr. Cresta Jones from the University of Minnesota, the only physician in the state to be board certified in both addiction medicine and in obstetrics. She's a maternal fetal medicine specialist there. And last year, just given the crisis that we've been seeing across our state in opioid and other substance use disorders, we noticed that particularly affecting women and individuals who are pregnant in the parenting period. And so we hosted a 7-month series focusing on that critical period for child and family development. And it was our highest attended ECHO series to date, with over 200 individual attendees hailing from about 100 different clinics that sparked numerous carry-on initiatives. We're continuing to help providers across the state with the expertise that we have in order to kind of promote this demand and be able to treat kids who have neonatal abstinence disorder, as well as this critical period for family development. So we're trying to launch a standalone prenatal and maternal health ECHO starting April 12th for about 12 months of funding kind of in between. But the point of why I bring this up is, even as Dr. Specker mentioned, the only ability that I was able to do this is because we've been able to secure external funding kind of scrapping along. I was funded by the National Institute for Alcohol Abuse and Alcoholism, as well as the Conrad Hilton and other foundations. But this is really piecemeal, and really being able to get sustainable funding for a 5-year period to train people that are critically, and this is demand skills, is really important. And as much as ECHO is making an important difference, these physicians that would be fellowship trained are critical. Even in the past few weeks at Hennepin, we've been getting 30 to 50 referrals per week for people seeking help. We're trying to hire a physician, but we're having a hard time finding another one who's board certified, who isn't already committed to another health system that's trying to do the same type of work. There remains a desperate need for specialty trained physicians. We need a sustainably funded fellowship in order to do that. So again, this bill, I'm very happy to hear that there's consideration for support to train 15 physicians over 5 years for that 1.2 million. So thank you to Senator Koran for authoring this legislation, and for Senator Tomassoni and all committee members for allowing me to testify today. Thank you.
Thank you for your testimony, Dr. Gran. Members, are there any questions are there any other testifiers, Senator Koran?
Mr. Chair, no.
Okay. Members, do we have any questions for any of the testifiers or Senator Koran? Senator Clausen.
Thank you, Mr. Chair. I can only speak in support of this bill. I'm glad that we're having a hearing here today and dealing with opioid crisis and having trained physicians to deal with that is extremely important. And this is a program that will do that. So I'm very supportive and thank you for our testifiers. Thank you, Senator Koran.
Senator Goggin.
Thank you, Mr. Chair. I'm looking at the last line 2.5. It says to prepare fellows to practice addiction medicine in rural and underserved areas of the state. What, do we have folks that are willing to go to outstate Minnesota to work in those areas, Senator Koran, or one of the doctors?
Senator Koran, do you wish to take this one?
Mr. Chair, we'll have Dr. Spector.
Dr.
Mr. Chair,
Becker.
Senator, there are two physicians that are starting our program now. One is currently in practice on Red Lake and will be coming down here to do specific fellowship. The other physician is an African-American physician in family medicine who is very dedicated and passionate about serving the African-American population. So we have really actively recruited physicians that are in areas that we know we need more service.
Follow-up, Senator Goggin? Nope. All right, members, any other questions? Seeing none, Senator Koran, closing comments.
Thank you, Mr. Chair. I think it's a great opportunity and of a greatest need. And so I think that our testifiers did a great job describing how it works today, and from personal experience, the need across our state and across the country. For $1.5 million, it seems like a great value for the money we get. And in addition to, as our second testifier talked about, how many other physicians or medical personnel are impacted in the training in which they then provide for everyone else. So it's a great investment. We appreciate your support.
Thank you, Senator Koran, and thank you for bringing this bill forward. And we will lay Senate File 3424 over for possible inclusion.
Thank you, Mr. Chair and committee. Thank you.
Next up, we have Senate File 4023, Senator Jasinski.
Oh, you did.
All right, Senator Jasinski moves Senate File 4023 to be in front of the committee. Senator Jasinski, to your bill.
Thank you, Mr. Chair. I also have an A1 amendment, which is a technical amendment.
All right, do we have the A1 Authors Amendment Committee? All in favor, say aye. Aye. Opposed, no. The amendment is adopted. To your bill is amended, Senator.
Thank you, Mr. Chair. This bill comes to me from the University of Minnesota for supplemental financing for campus safety. So with that, I'm going to turn it over to Mr. Franz.
Mr. Franz, please introduce yourself and begin your testimony.
Thank you, Mr. Chair. Myron Franz, I'm Senior Vice President, Finance and Operations at the University of Minnesota. Really want to thank the opportunity to be here today. Thank you, Senator Jasinski, for this important opportunity. You know, I'm going to say some obvious things here at first, but I think it's important to say the safety and security of all of our students, staff, and faculty, and the visitors on our campuses is one of our top priorities at the University of Minnesota. Now, several goals that we have in our strategic plan, we've talked about it in different contexts, our Impact 2025 strategic plan, really focus on transforming the culture, policies, and practices around all 5 campuses at the University of Minnesota to foster a safer climate for all of our visitors and students. When we talk about safety, though, we talk about it in a really holistic sense, a very broad sense. We talk about IT safety and security, building and lab security, environmental safety, public health, mental health, prevention of sexual misconduct, and public safety. Before I describe our request, I just want to mention that we've been actively engaged in the last year and a half, 2 years, to try to enhance the safety around our campuses. We've done more coordinating, planning, and community engagement. And one of the things that we've done in the last year and a half or 2 years is spend a lot of university funds, over $1.3 million funds in one-time money and about $1.3 million in ongoing funds to make some necessary improvements leading up to our request to you today. Some of the things that we've done in the last several years have been to add more visible University of Minnesota Police Department patrols in and around campus. We've been able to maintain a quick response to our 911 calls and emergencies on campus. We've had additional night security advisors who provide building security and escorts. We've equipped and trained officers with body-worn cameras. We've hired safety guides who provide wayfinding and safety services in and around the Dinkytown community. We've purchased a mobile escort app called Rave that anybody, student, faculty, or staff can load onto their phone and be able to enhance their safety by using that app. We've installed additional Blue Phone kiosks that you see around campus where they have the emergency phone and camera to help provide better control and access to our safety people around campus. We've embedded a social worker with the Twin Cities Campus Public Safety Department. We've created a community engagement team to make presentations, provide safety education, and participate in student-related activities. We've hired a civilian community liaison to work with the community engagement team. We've continued to invest in public safety's training, such as bias and de-escalation training, and we've really tried to control access to the buildings on campus to make sure that they're open to those who really have a reason to be there. One of the things we also are doing are leading efforts under the President's initiative to prevent sexual misconduct. This resulted in more training around the university to include sexual harassment training, prohibiting retaliation, and updating our discrimination policy. In the health and safety area, we've supported the university's response to pandemic planning. We've monitored indoor air. We've upgraded lab and research safety protocols. We've worked across the system on weather and emergency preparedness. We've added to our disaster recovery plans. You can see that we really have focused on the entire gamut of safety issues for our students, faculty, and staff. But let me talk to you right now about why we're here today. You know, to support our ongoing efforts, we really want to increase safety on all 5 campuses. We're asking the state for an investment of $100 million in additional safety and the security personnel, adding safety and security infrastructure to all 5 campuses. And of this amount, about $10 million is recurring funds. The remainder are one-time investments that I'll describe in just a moment. One of the things we know is that responding quickly and effectively to emergency situations is critical to keeping our communities safe. Safety IT systems, emergency responders are more successful when our campuses have highly or industry-recognized cameras, building access, and lighting systems in place, which many of them do not. The request for $90 million in one-time funding is for these security systems that we would focus on all 5 campuses. It would also fund the behind-the-scenes technology that keeps the systems and data within them working, secure, and updated. For example, with updates and an expansion to the electronic building access system, during an emergency, we could lock down every building on any campus with the mere push of a button. Or many cases where we still use keys, we could set automatic timers for all buildings on a campus to open and close at certain times, instead of having to manually unlock and lock those buildings. The $10 million recurring funding would support the university's commitment to providing safe campus environment through advanced programming in public safety, student health, IT infrastructure, and health and safety. This proposal provides ongoing funding for system-wide cameras, building access, alarm monitoring, and personnel to manage the operations and maintenance of these security systems. Our proposal would also fund additional uniformed security and safety escort personnel, as well as additional police officers and first responders. The funding we are requesting here builds on those efforts and will enhance our existing infrastructure to improve safety, security, and health for all of our students, faculty, and staff, and those people who visit our campuses. Mr. Chair, I'd like to ask Vice President Bernie Golachek to come up and talk about the IT components, if that's okay.
Absolutely. Mr. Golachek, if you would please identify yourself for the record and begin your testimony.
Thank you, Mr. Chair. My name is Bernie Golachek. I'm the Vice President for Information Technologies at the University of Minnesota. As you heard from Mr. Franz just a moment ago, the University of Minnesota needs to make a significant investment in the ways that it secures and provides access to its buildings. To do this, the institution needs to enhance the security and access controls to the computer systems that serve as the brains to these safety measures, and also to the systems that contain the university's critical and sensitive student, staff, and business data. As you know, the University of Minnesota manages systems and tools to conduct its teaching and learning, research and discovery and outreach mission. Its day-to-day business operations depend on the performance of these systems, and the pandemic has only served to underscore the importance of technologies. Like many enterprises, the University of Minnesota is vulnerable to cybersecurity threats and ransomware attacks. These cyber attacks can result in the theft of university student data, or worse yet, alter the data so that students no longer have an accurate record of academic progress or degree received. In addition to the threat of data integrity, cyber attacks in the form of ransomware have the potential of locking university staff out of systems, resulting in an inability for the university to function for days or even weeks. The way to mitigate these risks is to invest in modernized computer systems, automation, and the training needed to operate these increasingly complex tools. We need to be relentless in the way that we manage security. That's why this legislative request is so important. The specific University of Minnesota technology security investment that we propose today will be used to modernize the computer systems and the foundational processes that are needed to secure and prevent inappropriate and unauthorized access. This will benefit students, faculty, and staff by keeping sensitive and private data secure, by preserving the academic and transcript integrity of current students and graduates of the university, and finally, by maintaining the continuity of the university's day-to-day operations by preventing unauthorized access to the university's most critical spaces and systems. The non-recurring funding will provide software, systems, and professional services to remediate existing vulnerabilities in our environment. This is not critical this is very critical back office, behind-the-scenes equipment and activities that are not visible, but are extraordinarily important to secure the systems and data from bad actors. The recurring funding will sustainably operate these computer systems and processes into the future. Colleagues, the internet was founded on the assumption of trust between systems that are connected to each other and the assumed trust of those who use those systems. These assumptions have been radically flipped 180 degrees and are now an assumption of zero trust. Mr. Chair, members of the committee and committee staff, the funding proposed here will help the university respond to this new zero trust physical and virtual landscape. It will ensure secure access to spaces, systems, business data, and the private information of our students, staff, and faculty. With your permission, Mr. Chair, I'd like to turn this testimony back to Mr. Franz for his closing remarks.
Thank you very much, yes.
Thank you.
Mr. Franz.
Thank you. Let me just conclude by saying, public safety is a top priority for us. We've heard from a lot of folks, and I know you have too. We've heard from students, we've heard from their parents, we've heard from faculty and staff, and about the need to enhance safety. And we've responded. We have invested our own resources, and we put into place numerous programs and initiatives to keep our students and employees safe. But there's more to do, and we need help from the state to do that. And we're here to ask you today for your help and partnership in this effort. So thank you, and I'm happy to take any answers, and thank you, Senator Jasinski.
All right, members, do we have any questions? Senator Goggin.
Yes, Mr. Chair, thank you. I have two questions. Under the security infrastructure FTEs, is there a total number of FTEs that you're planning to add? Because I see down below you have 10 additional officers and equipment and 12 additional security advisors. Just curious how many FTEs for the security infrastructure line?
Senior Vice President
Mr. Chair,
Franz.
Senator, well, you have that chart, the list there that shows the FTEs. Yeah, and that is what we anticipate for the infrastructure component. The top part of the chart is geared toward public safety, and the bottom part is on the tech portion. And so those are geared toward the tech support. some of those are geared toward supporting the public safety infrastructure too.
Mr. Chair?
Senator Goggin.
So the fiber to the Duluth parking lots, that's for adding cameras and surveillance equipment is more than likely, is that correct? Okay,
Mr. Chair, yes, Senator.
thank you. No more questions.
Senator Clausen.
Thank you, Mr. Chair. And I certainly support the idea that you have to have a safe environment for learning, no question about that. My question is maybe similar to Senator Goggins. I was just going to ask about uniformed officers. I think you mentioned that. I'm just curious, as you're looking to perhaps add to the campus police force, how many officers you might be looking at?
Senior Vice President.
Mr. Chair, Senator, that's a great question. Right now, we have our sworn officer authorization for UMPD is 61, and we're right now at about 52. Our needs show that we should have about 71. Now, clearly, given the current hiring environment and challenge, it's going to be virtually impossible to get there anytime in the next year or so. So this is really a pathway that we think to get to the level of support that we think is consistent with other major universities, especially major universities in a large metropolitan area, but also for the other 4 campuses. So that's our growth pattern, is from authorized 61 to authorized 71, but we're only at 52 right now, really engaged a lot in hiring and retention opportunities for our current officers.
I'm going to have a quick follow, okay. When you talk about that, so is that system-wide, or is that the Twin Cities campus for that 71?
Mr. Chair, yes, I should be more clear. That's Twin Cities campus. I don't have the numbers for the other campuses, but this is Twin Cities only.
Okay, thank you. Any other questions from the committee? One other that I have, with the cameras, is that going to be something that the university itself is going to be monitoring on a regular basis? Is that going to be basically just recordings to look back? Or is there going to be an outside group that's hired to do monitoring to see what's happening?
Mr. Chair, that's a great question, because we're analyzing that now. There are systems out there. Some of you may have heard of some of the systems that can do artificial intelligence to monitor activities and kind of alert security personnel when something is happening out of the ordinary. So we're looking at some of those things because, one of the things we don't want to have a lot of people staring at monitors and not being able to have value added. So that's one of the challenges, is coming up with a system that really provides the right kind of information to the right person at the right time. So we're looking at those new technologies that are out there. We're looking at, and there are some of these technologies that do make more sense sometimes to contract out, but we're not that far along yet in our analysis of what we would do. But I think we're going to see a combination of ways to try to address that monitoring function.
Okay, thank you. And you started to allude to it in your testimony, but when it comes to the securing the buildings and all of that, you mentioned that maybe some of it will be looked at time of day locks, things like that, because I know a lot of people, a lot of the university buildings are kind of public space as well. So is it going to be kind of a combination of things where students will be maybe given like a fob that will get them access to certain areas? Faculty will have different ones to close off maybe their areas, but still have areas open to the public who wouldn't have something? And then what do you think is your timeline for being able to get this all in place?
Oh, thank you, Mr. Chair. I'll let Vice President Gulichek answer the last one. Gulichek, on the first part of that, I think one of the things that we want to do is to try to be able to make those really open public spaces open during regular business hours. But we have found that in a lot of the, especially during COVID, now COVID's a unique period to analyze because there was so little activity that you didn't want to leave these buildings just open without anyone in them, so to speak. And so one of the things we want to do going forward is we look to every building and analyze each and every building in terms of what's going on in that building. Is it simply lab work that only employees and professional staff should be in there? If so, then it should be locked. And we do have already a fob access system where students can access any of the buildings they need to get into, and so can staff. So we have the ability to make those kind of controls now. But going forward, we really want to make sure that like the Kaufman Student Union obviously will be open, in open business hours, and the libraries. But there are some buildings that are pretty quiet during the day. Classrooms obviously will be open. But we want to have the ability to make sure that we can sort of mix and match to make sure that the faculty and students that need to be in a building can get in. And if it's no public activity going on, then it makes sense for everyone's safety, to keep that building more restricted. But that's a balance. I mean, you don't want to over-restrict access to our public buildings. So it's not something that we know we're still working on. But Vice President, you want to talk about the timeline?
Thank you. Mr. Gulicek to the timing.
Mr. Chair, thank you. The timeline obviously is as soon as is possible, correct? I mean, there is a significant amount of gear that would need to be acquired, both at the endpoint, cameras, building access or room access sensors. And then there's a lot of infrastructure and software that is needed on this sort of the central brain trust side. So we would implement as soon as possible and as quickly as possible, prioritizing those areas of vulnerability at our highest priority.
Thank you. Do you envision like a 2 to 3 year process, potentially more?
I would expect that this would be within 2 to 3 years. It's a significant expense upfront to acquire and install the technologies, but we would hope to have them complete within the 2 to 3 year time frame.
Very good. Any other questions? Senator Goggin.
You made me do this, Mr. Chair. With the equipment you're purchasing, roughly, what's the expected lifespan for the equipment? Is it 4 years, 5 years, 6 years? Same with the software, because I noticed in the spreadsheet, we have significant ongoing annual costs for maintenance and that, for licensing and that. So just curious what kind of time frame we're looking at.
Mr. Gulicek.
Mr. Chair, Senator, great question. The timelines for technology vary. If you were to ask me if we should align to the technologies that we've worked the lifespan until the time that we are here today, some of our cameras are very, very old. And if you're going to maintain an infrastructure like this, you need continuous investment, right? With digital technologies and the way that they operate today, I would expect a lifespan of 10 years. And the central sort of brain trust for that would be the same.
Follow up? Okay. Senator Putnam.
Thank you, Mr. Chair. My question is most likely for Vice President Galachik. First, thank you for all your work you're doing for this. Keeping a safe learning environment is incredibly important for everyone who's on campus, students and others as well. But in looking at the budget, I'm struck by access controls. It's $25 million. That's a quarter of the whole. What is that? And why is it so expensive?
Mr. Galachik.
Thank you, Chair. Senator, that is a number of things. They are sensors that are mounted to doorways and to buildings. So there's a significant expense both in the technology and the installation of that technology. And when you count the number of buildings system-wide at the institution, you get to a big number really fast. But it also includes fobs, it includes eye scan technologies, it involves a number of different access control technologies that ensure that the person who should have access is gained access in the right way.
Follow up, Senator Putnam.
If I may, thank you, Mr. Chair. So the question of the fob and some of these other implements that are going to be introduced, will any of these be passed on expenses to students? Will a student have to pay extra for a fob, or is it part of their regular tuition charges and those kinds of things?
Mr. Galachik.
Mr. Chair, Senator, it is, I would say that it is both. This legislation will fund much of, if not all of that. The institution's U-cards that each student, staff, and instructor have serve as a fob. And so it's a proximity sensor, a card access reader, if you will, that everyone has in their pockets today. So we would leverage that to the extent that we can so that we would not burden the institution or our students with any more costs.
Any other questions from the committee members? Seeing none, this bill is going to be going to finance. So Senator Jasinski, would you like to move that Senate File 4023 as amended be passed and referred to the Finance Committee?
Thank you, Mr. Chair. Just a couple quick comments before I do
yeah,
that.
sorry.
I want a couple closing comments. I want to thank the committee. Again, when I first looked at the bill, $100 million is a lot of money, but it's a huge institution. And I know many of you have children and probably all in college at this point or have been in college. It's so important to make sure that our students are safe, and this really brings the whole University of Minnesota system up to today's technology and will continue on in the future. I think it's a very important bill, so that's the reason I did carry it. But I will tell you, you look at that first $100 million, and it does seem like a lot of money, but again, it's a huge facility, huge campuses, so it's very important. So with that, I would move Senate File 4023 as amended be passed and forwarded to Finance.
Members, all in favor, say aye. Aye. Opposed, no. It is passed, and you're on the way to finance. Thank you, Senator.
All right, up next is Senate File 4056, Senator Rarick. We'll move Senate File 4056. Senator Rarick, to your bill.
Thank you, Mr. Chair and members. Senate File 4056 is a bill that I'm proud to carry because Minnesota Independence College and community is transforming the lives of students with autism and learning differences and their families through this program, helping our state fill the workforce shortage and also delivering a strong positive return on investment to Minnesota's economy and our society. This bill provides additional funding to MICC for tuition reduction and institutional support. With this funding, MICC will have the ability to expand its program and enrollment. They currently have a waiting list, and this funding will give more young adults with autism and learning differences the opportunity to receive the highest level post-secondary education that they deserve. MICC's statistics for their students are truly remarkable, and their commitment to student success is unmatched. After their students graduate, they provide social and professional career services to them for the rest of their lives through their community program. In addition to the transformational education they provide, a study completed by Wilder Research showed that the return on investment to Minnesota's economy is strong. For every $1 the state invests in MICC, the return on investment is $38. The options for students with learning differences to receive post-secondary education are very limited. I appreciate the mission and commitment of MICC to our state. They provide their students with educational tools to fulfill their potential, and I believe everyone deserves that opportunity. Thank you again for your time today. I would appreciate your support on Senate File 4056, and I will now turn it over to our testifiers from MICC.
Thank you for being here today. If you would please state your name for the record and begin your testimony, please.
Good afternoon. For the record, my name is Amy Goodmisted, and I am the Executive Director at Minnesota Independence College and Community. Mr. Chair and members of the committee, I'd like to thank you for your time today as I speak in favor of Senate File 4056. MICC provides post-secondary college program to young adults with autism spectrum disorders and learning differences. With autism spectrum disorder diagnosis on the rise, this is a critical time to expand our program and to serve more students while also making sure it is affordable to families at all income levels. We are proud of our programming and the success that our participants achieve, far exceeding national statistics. MICC is the only program of its kind in the nation, and we are committed to continuing to work with you to make Minnesota a leader in education for all students, including those that require a different pathway to success. It is important to understand that statistics about young adults with autism and learning differences across the country to fully understand how critical the programming at MICC is. Some of the national statistics include that only 1/3 of individuals with autism have any kind of post-secondary education. Less than half have held any kind of paid employment within 4 years of graduating from high school. 87% continue to live with their parents after high school. 24% are considered socially isolated, meaning they have not had any contact with anyone outside of their family for over a year, and that is a pre-pandemic statistic. These statistics are not a reflection of a lack of desire or ability, it is a lack of options. At MICC, we provide an opportunity for these young adults to completely transform their future by gaining the skills they need to live independently, secure and maintain meaningful employment, and be a part of a community where they both feel accepted and appreciated. Every year, across the United States, it is projected that an average of 100,000 individuals on the autism spectrum will turn 18. This adds up to about 1 million youth on the autism spectrum entering adulthood over the next decade. In Minnesota, the number of students on the autism spectrum receiving special education services has grown by 138% since 2009. We need to expand our programs to accommodate the increase in students that need the education that MICC provides. We are actively working to be expanding our current campus in Richfield as well as an expansion to other regions in the state of Minnesota. We are aware of the importance of addressing Minnesota's workforce shortage. Our career certificate program covers high-need job areas. MICC's career certificates include the retail program, culinary, hospitality, and health services. All of our career certificates are endorsed by Century College. You may see our students and graduates at over 50 local employers, such as Bachman's, Delta, Walgreens, Presbyterian Homes, Best Buy, Speedway, the Guthrie, the YMCA, and more. Currently, we are very proud of our employment rate, which is at 98%. As Senator Rarick mentioned, MICC provides a strong financial return on investment back to the state of Minnesota. Wilder research found that for every dollar you, as the state of Minnesota, invest in MICC, there is a $38 return. So I would like to sincerely thank you for the support that you have provided to MICC. Your investment continues to have a truly incredible impact on the lives of students, graduates, families, and citizens across Minnesota and the country. And with your permission, Mr. Chair, I would like to have Trina Soletto, who is on Zoom, share a video so we can see more from the MICC students.
Thank you, Ms. Stead, and yes, we'd love to see that video. So, are you able to get it shared?
You can actually see my face.
Today is February 7th of 2022.
Hair back, eyes on camera, get the giggles out now. Okay.
Generations of Autobots and Decepticons that have never seen a Cybertron unscathed by war.
Cut. If I could go back in time and say something to my high school self, it would definitely be, you don't know how much you're capable of.
I came to MICC to learn about how to
how to get a job after I graduated.
Laundry used to be such a impossible feat.
I didn't think I could speak up for myself that much.
I want people to know with disabilities that you can still go to college and have a great life and learn how to live independently.
Just because someone has it doesn't mean they can't be successful.
Autism is not necessarily a disability. It has like some disabilities and it has different abilities.
Everyone with autism has their own little ways of making things work. And it's all about identifying how the person goes about to expressing themselves and those quirks and what they want to do.
I'm tired of being told I can't, and I want to show them I can. And everyday tasks may be difficult for us at first, but once we learn how to do it, we just need the support.
It takes a lot of practice to do so. The more you practice, the more you get better at it. And that's how you develop that skill.
I feel like sometimes I can't do things, but then I realize, oh yeah, I can.
I know it sounds a little cliche, but no matter who you are, no matter what you're diagnosed with, no matter all the labels that you have and all the labels that the world gives us, it's nothing.
Neurodiversity is we don't fit the standard idea of how a person behaves, how a person thinks, but that doesn't mean we're any less human.
MICC, I feel, delivers that missing link, that little extra oomph to be able to figure out what we want to do and to kind of break out of the mold.
Do what makes you happy. Do what you're passionate about. Don't let people tell you what you can't do.
Thank you very much for that video. Appreciate that. And I definitely like the part where they say they're tired of hearing you can't, but they know they can. So I'm very proud of that. I have a next door neighbor that is autistic, and he does a lot of good things.
Yes. Thank you, Mr. Chair. I have one of the students from the video with me today. If it is okay, I'd love to have him come up and speak to the group.
Please.
Thank you.
If you could state your name for the record, please, and then begin your testimony.
Hello, everybody. My name is Aaron Cardenas. I'm a freshman at Minnesota Independence College of Community, or it's MICC for short. I'm from West Bloomington, Minnesota, and I'm glad that I'm able to go to a college that is close to home. My mom found MICC and thought it would be the right opportunity for me, and I liked the idea. At first, I was nervous because I thought I would be homesick, but I'm loving being independent. I do sometimes still miss my parents, but I am very happy to be at college. I'm learning about managing effective relationships. I have made many friends at MICC. My friends are supportive and nice. I try to be outgoing to make more friends, and I encourage my peers to do the same. And we feel safe to be ourselves. I have started to develop public transportation skills. I am feeling more confident now that I have classes to teach me how to take the bus and other public transportations. It is really fun to meet new friends and get to know them. We like to participate in activities and excursions together, such as going to the zoo or Minnehaha Falls. Also to play Super Smash Bros. Ultimate, play kickball, basketball, or any other sport, or board games have been some of my favorite activities so far. We even get to request our favorite activities. In my apartment, I'm learning how important it is to eat healthy foods like protein, fruit, vegetables, and whole grains. Without anyone cooking for me, my family is really impressed with the progress I made. When I went home for Thanksgiving, I even helped with the cooking, and they really appreciate that. We also try to keep our apartment clean. My apartment instructor tells us it is one of the cleanest on campus. I am also learning to keep track of my own money and not to spend too much over my budget. The staff at MICC is great at working with each of us individually to figure out the best way to learn. I know that I will continue to learn many more things and gain new skills during my time here. In my opinion, without MICC, I would not be on a successful track that I am now. A big achievement I had never thought I could have is to have a job because it would be too hard. But guess what? I'm not even graduating yet. And I already have a job at Lunds Barley's in Prairie, and it is going great. I have challenges sometimes, but I face them. And when I need help, I know I just have to ask for help. What I also love about being at MICC is that after I graduate from senior year, I can become a community member, which means that I can still be an active part of the MICC community to participate in social activities. I also have support from the career department. I want to thank everyone at MICC for supporting my education. Thanks to my parents for being very supportive of me. And I want to thank all of you at the legislature for supporting students like me with autism and other learning differences. I've learned that by having autism, I have my own strengths and limitations. Just like everybody else, I'm proud of who I am. Please support this bill so more students like me have access to the education they need. MICC is changing my life every day, and I love it. I'm doing things that I never thought I would be able to do. Thank you for supporting MICC. We appreciate all your hard work. You are awesome. Thank you for listening. I hope you enjoyed my speech. I'm happy to answer any questions.
Well, thank you, Mr. Cardenas, and congratulations on your job.
Thank you.
And I might have to invite you over to help me cook Easter dinner. So. Members, do we have any questions? Senator Putnam.
Yeah, well, thank you, Ms. Goodmestead and Mr. Cardenas for being here and for the great work that you're doing with an incredibly important group of people. It's heartening to see. And also, it's kind of neat to see Mr. Cardenas here because we just saw him on TV. He's like famous and stuff. I do have a sort of more concrete question for you, Ms. Goodmestead, if you wouldn't mind. And that's, I'm curious about what's the price tag? What does it cost someone to go to this school, both in terms of tuition and residential expenses?
Sure. The tuition is an all-inclusive tuition. This year is $46,000. That is all the education, the room with the board, the groceries, everything that Aaron had mentioned. So the state has provided the financial resources to provide financial assistance to participants, which has been amazing.
Senator Putnam.
Thank you, Mr. Chair. Could you break that down a little bit between the residential and the cost of instruction?
Sure. The residential, the room and board residential is about $10,000. Yep. And the rest is for programming.
And
Senator
just one more
Putnam.
question, if you wouldn't mind, Ms. Curtis. What percentage of your students pay the full ticket price versus some sort of grant or scholarship?
I would say about 30% pay the full price. Correct.
Thank you, Mr. Chair.
Senator Jasinski.
Thank you, Mr. Chair, and thank you, Senator Putnam. There's a couple of my questions that answered, but Mr. Cardenas, could you tell us a little bit about your jobs at Lunds and Byerly's, what you do and how long you've been there and what you enjoy about it?
All right. So I'm a courtesy clerk at Lunds Byerly's in Eden Prairie. I've worked there for almost 5 years. And we also have carts that we load groceries if customers have a lot. We wheel them out to their car.
Thank you.
You're welcome.
Thank you, Mr. Chair. Just a question for students. Could you kind of break down how many hours they spend in the classroom, and then how many hours might they spend on their work site?
Sure. So we have a very large curriculum. They are, well, number one, we're teaching 24 hours a day is basically the way we look at it because of the skills. We're teaching social skills as well as independent living and career skills. So I would say our careers programming is happening about 4 to 5 hours a day. We are on site for 2 of those hours, and then we'll be off at a practicum where they're getting hands-on experience with employers that are allowing our students to come in and in those specialty areas of retail, culinary, hospitality, and health services, they go right into those environments and learn from those areas. And that's about 4 hours a day that they would get that chance.
Senator Clausen?
Thank you. Just to clarify then, at 4 hours a day, they'd be on a job situation, is that what you're
In a
saying?
learning experience with the careers program, yes. So it would be out in the community.
Okay, thank you.
Any additional questions? Don't see any hands up. Well, I thank you very much, Senator Rarick. Any final comments?
Thank you, Mr. Chair and members. You know, for a few years now here, this group has come forward, and I think when we see the video and especially the personal testimony, you see the great work that the MICC is doing. These are pretty special individuals, and given this opportunity, they can thrive. And I'm very happy to support this, and am hoping that we can include some of this in our final bill. So thank you, Mr. Chair.
Well, thank you, Senator Rarick, and with that, we will lay Senate File 4056 over for possible inclusion in the higher ed bill. Oh, Senator Clausen.
Thank you, Mr. Chair. Just a question. We've heard quite a few bills that we're passing on to an omnibus bill that have financial considerations attached. When do you see that we'd have a target that we'd be working on?
Senator Rarick.
Thank you, Mr. Chair. We are asking those questions as well. We do not have that information at this point, but we have been talking with our leadership, kind of have some priorities, especially that we're looking at, and Senator Tomassoni has been in communication with them as well. Like I said, I'm kind of deferring to Senator Tomassoni at this point yet, but we're still looking for some of that guidance as well. But we're keeping track of everything that's been in front of us, and so when we do finally get a number, I think Senator Tomassoni is pretty prepared to get something together for us.
Okay. All right, with that, Senator Rarick, we have Senate File 4154. To your bill, Senator Rarick.
Thank you, Mr. Chair, and believe we have an A1 author's amendment, and I also believe Senator Tomassoni would like to speak to that amendment.
Okay. Senator Tomassoni moves Senate File, the amendment A1 for Senate File 4154. And Senator Tomassoni, please go ahead and start your testimony.
Thanks, Mr. Chair. I am okay with UMD, but the bill as written eliminates Mesabi as a place to go to utilize the program. Representative Rukavina would roll over in his grave if we were to do that, and probably come back to haunt me, not to mention what he might do when I get there to join him. So the amendment simply reinstates Mesabi. Thanks, Mr. Chair. This is an author's amendment.
Thank you, Senator Tomassoni, and best of luck with with your future meetings. All those in favor of the A1 amendment, say aye.
Aye.
Opposed, say nay. Amendment's adopted. Senator Rarick, to your bill.
Thank you, Mr. Chair. Senate File 4154 is a bill that seeks to modernize language in the state statute that provides structure around the University of Minnesota's permanent university funding. The purpose of these updates is to better utilize available funding through the U of M account to bring more benefit and workforce development to the Iron Range region. And with that, I will turn it over to my testifier who knows it way better than I do.
All right. Thank you, Senator Rarick. Dr. Wendy Reed, if you would say your name for the record and begin your testimony, please.
I am Lynn Williams. Wendy Reed, my colleague, is on virtually, and I will
sorry.
turn it over to her in a minute because she definitely knows the details. But I'm Lynn Williams, and I am very proud to lead University of Minnesota Duluth's marketing and public relations. So thank you all for your time here today. Thank you to Senator Rarick for leading this, and Senator Bach for helping to support it, and Senator Tomassoni, who's been supportive in these conversations and very supportive of his fine-tuning to that wording, and appreciate his amendment for sure. So joining virtually, as I mentioned, is Wendy Reed. She is our Dean of the Swenson College of Science and Engineering. She'll provide the heart to this testimony and the details today. I also want to mention here with me today is our Chief Government Relations Officer, J.D. Burton, and Regent McMillan is around somewhere, popping in and out. So we're very pleased to be here and talk with you about this. As mentioned, the purpose of this bill is to update state statute language to better utilize the available resources and bring benefit and workforce development to the Iron Range. We feel that these updates will allow us to better serve the range in the region, and we're very grateful for the conversations that our legislative delegation has provided to help us get to this point and to work out these details and concept what this looks like. So I will, at this point in time, ask to turn it over to Dr. Wendy Reed, who is the Dean of our Swenson College of Science and Engineering.
Thank you, Ms. Williams. And Dr. Reed, if you could state your name for the testimony, or for the record, and begin your testimony.
Thank you. Chair Tomassoni, Vice Chair Rarick, Senate committee members, and Chair Goggin. My name is Wendy Reed, and I'm the Dean of Swenson College of Science and Engineering here at University of Minnesota Duluth. I'm going to give a quick overview of what the Permanent University Fund is. So the 1851 charter, which formed the University of Minnesota, included lands granted by the United States Congress in support of a university. So this is part of what makes us a land grant institution. A significant portion of the permanent university land contains valuable deposits of iron ore and taconite, and revenue from the land is deposited into an account known as the Permanent University Fund, or the PUF Fund. So the investment management of the PUF is under the jurisdiction of the University of Minnesota Board of Regents. These PUF funds are specific and they're exclusive to the University of Minnesota. So the income must be used to enhance the mission of the U of M, and the appropriation must not be used to reduce other kinds of appropriations. And the fund is really split between 4 different accounts, and we're seeking to update language in one of those 4 portions. The goal is really to modernize the language and stay true to the original intent of the legislation, which was to support workforce development in mining, mineralogical, and mining-related fields. So UMD and Swenson College of Science and Engineering are really committed to our land grant mission and the responsibility that we have to support education for the Iron Range industries and the Iron Range communities. So these updates, they don't affect other entities and the funds or the funds for other entities, and there is no fiscal note. These edits only impact one portion of the state statute and a portion that's already designated to UMD. So the way the language was originally written, the funding in this endowment can only be used for one singular engineering degree program. And UMD currently fulfills that through the Iron Range graduate engineering programs, which provided really important programming for our practicing engineers on the range, and we intend to continue those. But there's more that we can do. There's more good that we can do. There are financial resources available in the fund that we can't use right now. The changes that we're proposing will allow us to provide scholarships to over 300 students from the Iron Range earning STEM degrees in Swenson College as early as fall 2022. They also maintain the focus on supporting workforce development and the collaborations benefiting the regional academics, industry, and natural resources on the Iron Range in Northeast Minnesota and in collaboration with our Minnesota North College partners. The proposed updates to the PUF statute maintain the connection and the intention for Iron Range academics scholarship support through UMD by broadening the language to allow for additional academic programming and undergraduate students committed to STEM degrees. Right now, the UMD staff member who runs the Iron Range Graduate Engineering Program maintains an office at the Mesabi Range College. This college continues to be a very important partner for us. We appreciate and support the amendment from Senator Tomassoni, and we do not expect to change our connection with Mesabi Range College. In fact, we hope we can expand our collaboration with all of the newly named Minnesota North colleges. With the updated language, we expect to have more alignment and more collaboration with the Minnesota North schools and to better support students wanting to transfer to UMD after successfully completing their 2-year degrees at the Minnesota North colleges. One other update that we recommend is to move from a fixed scholarship amount of $6,500 maximum per year to a percentage of 75% of this current state tuition. This change would allow for automatic adjustments in scholarship levels as tuition rates fluctuate. So with these minor updates in the language, the university will be able to effectively use the available resources for optimal impact on the Iron Range now and into the future. So we ask for your and appreciate your support to get these changes done. With that, we can open up to any questions for Lynn or I or any of the other representatives from the University of Minnesota.
Thank you, Dr. Reed. Members, any questions? Senator Clausen.
Thank you, Mr. Chair. I'm just curious on how many students are receiving this scholarship on an annual basis, if we could. And then also, it is a continuing 4-year scholarship.
Yes, so currently the scholarships support students in the continuing graduate education program, and we typically have right between 10 and 12 students. So it would leverage this to over 300 students that we would be able to provide scholarships for. So it really has a large impact. And these can be up to 4 years of scholarship funding that we have.
Any follow-up, Senator Clausen?
That's a big increase.
It is a big increase.
It's impressive. Thank you.
You're welcome. Seeing no further questions, Senator Rarick, any final comments?
Thank you, Mr. Chair and members. As we all know, there are many things over the course of time that need updating and changing to meet the current ways of today. This is one of those, and I think as we just heard, this change will greatly benefit many students from the Iron Range area. So thank you everyone for the time, and definitely hoping we can convince the chair to include this one.
Somehow I think we will. With that, members, we will lay this Senate File 4154 as amended over for possible inclusion in the omnibus bill. With that, we have no further bills in front of us or business, so with that, we will adjourn the meeting. Thanks, everyone. End of meeting.
Thank you.